great day, Louisiana. We are out here in Gray, Louisiana this morning because Headache and Pain Center, they are celebrating over 20 years of business. And guess what? The man behind all of it is joining me now. Please welcome Dr. Jimmy Ponder Jr., the president and CEO. Welcome, my good sir. Good to see you.
Nice to be here.
Nice to be here at your wonderful facility. Congratulations on over 20 years of Headache and Pain Center.
Thank you.
It is amazing in here. I have to know there are so many different types of pains and medications out there. What do you and your professional staff do here at Headache and Pain Center? Because clearly he loves his staff.
Yes, I do. Well, the main thing that we want to do when we see someone is we want to accurately diagnose where their pain is coming from. And we do that through a careful history and physical examination. That may lead to other testing such as MRIs, CAT scans, and x-rays, things like that. But the premise of our treatment is that we want to do non-opioid or non-habit forming medications and no open surgery to try and relieve pain.
Okay, joining me now is a physician assistant here at Headache and Pain Center. Please welcome Miss Mimi Wilson.
Well, hi, how are you?
I'm wonderful, how are you?
Very nice.
I know you are, for sure. I have to know, for people who are watching at home, who are kind of wondering, when should I actually go and see the doctor? What are some of those signs and symptoms we should be looking for?
Well, if the pain is becoming too severe, you may experience a loss of function, such as walking. It may be difficult to perform that, maybe getting dressed, work duties, leisure activities.
Absolutely. And then once they do finally say, I need to go see somebody, and they come to Headache and Pain Center, how do you all make the experience great from beginning to end?
Well, we try to do a thorough evaluation and consultation with the patient, and that starts by getting a really good background in history, medical history, surgical history, and then we do a thorough physical exam. Then, through our medical decision-making process, we can do diagnostic workup and evaluation, and then make a good treatment plan based on that.
Joining me now is another one of the doctors here at Headache and Pain Center. Please welcome Dr. Quadra. Hello, my good sir.
Hello, sir.
I'm so glad to be interviewing you. Okay, I see this in the movies all the time. Tell us about the technology you all use to get pictures like this.
We use open MRI. We use bone density tests. We use ultrasound and fluoroscopy as well.
All different types of things. And how do you then use that technology to help these patients who have the pain?
To target the areas that are affected or the patient has a problem with.
Joining me now is Christine Flores. She was a patient here at Headache and Pain Center. And Christine, I find it so interesting. You really were trying to find a non-surgical approach. How did they help you here at this facility?
Well, they gave me the options of what they could do to help alleviate the pain, because I could hardly walk. I was in so much pain. And it was called a caudal cath. And I had 3 sessions of that, and I went from not being able to walk across the room to doing anything, holding my grandbabies.
And now you can do all of that.
I can do all of it.
Joining me now is Carrie Laperouse, and you are definitely a very interesting case because you worked out, but then you couldn't work out anymore because you had sciatica. How did they help you here live a pain-free lifestyle?
Well, I came into the clinic because I didn't want to have an operation and see what they can do for me. I did a couple of procedures and waited around for a while, did a little small exercise and walking around and moving it a little bit more, doing a lot of stretches and yogas and all. Then finally I got back to be able to run in my 3 miles, 4 miles, and then it kept growing and growing. I was able to exercise without pain anymore. And it got to the point where finally I started to be able to do competitions again and do my Ironman competitions. And it was painless. Without having the procedure, I couldn't do the things that I did before.
That is amazing, and now he is, as you can see, a 4-time Ironman?
Yep, 3 halves and 1 full Ironman.
Unbelievable. Go ahead, Carrie. Congratulations.
Thank you, thank you.
All right, joining me now is Mr. Cecil Melanson. And Cecil, I need to know what brought you into this facility?
Lower pain in my lower spine, diagnosed as spinal stenosis, degenerative arthritis, and osteoarthritis.
My goodness, the list goes on, and hopefully you're doing really good today because of Headache and Pain Center, right?
Yeah, I've had a series of several shots of procedures that have gotten me out of pain.
And now, Cecil, that you have been treated here at Headache and Pain Center, what are some of the activities that you like to do now that you live a pain-free lifestyle?
Well, my main thing is walking. That's about, with my age, that's about what I'm limited to do, is walking.
So, Dr. Ponder, obviously you treat a whole bunch of different conditions here.
Yes,
What
we
are
do,
some that you really do here?
Well, we treat low back pain and neck pain. Spine pain is probably the most common thing that we see. But we also treat shingles. Sciatica is a very common thing that we see, and also people that have joint pain, shoulder pain, hip pain, knee pain.
It is a lot. And again, you've been open for 20 years, and cheers to 20 more years. Thank you so much for what you're doing for
thank
South
you.
Louisiana.
Yeah.
You are wonderful, my
Thank
good
you.
sir. Hey, if you want more information about Headache and Pain Center, just go ahead and head over to the website, answertopain.com. They have 2 locations, but they service really all of South Louisiana. The number to call is 1-888-415-MD-MD. That's 1-888-415-6363. And you're seeing both of the address of both locations on your screen right now.